May was Proper Posture Month. I'm Dr. Meagan von Holtz, and I thought it might be entertaining to illustrate some of the terribly incorrect and often comical seated postures that I witnessed last month. If you think about it though, there's a lot of different variations to seated posture, and they can depend on what you're wearing, your body type, how much energy you have that day, even your personality. So here's 4 that I witnessed. One day there was a woman coming in and her son was waiting for her. He's about 17 years old and he comes in and he does this. First, ouch. I mean, he's 17, he can deal with that, but 10, 20 years later, slamming all your weight on the sacrum like that, you're not really gonna recover the same. I also saw a young woman in a beautiful dress. She was trying to politely cross her legs, but I don't know how she did it. She had them all crossed like this. How's the blood supposed to flow? And then I saw this multiple times. This is the I am becoming one with my cell phone posture. Are you guilty of that posture? And honestly, because I can take it as well as I can dish it, I notice that I have terrible seated posture at times too. I am very short, so if I sit in a chair the way that you're supposed to, my legs dangle like a 10-year-old girl, and that irritates me beyond end. So I try to cross my legs. Now on a wide chair, I can cross them like this, no problem. Probably not the best for blood flow. But there's a lot of narrow chairs at my house, so what I tend to do, bring one leg up, this one over, fit my arms in this way, and this is how I work on my laptop at night. And I wonder why the next morning my back and my left shoulder hurt. Go figure. So all of us, even those who know exactly the way to have correct posture, we struggle with it. But I thought, let me explain what normal should look like. And we'll use my great pal here, Gertrude. So when we look at her, here's her skull. Her neck curve comes forward, the mid-back comes backward, the low back comes forward, and then here, this part, this is her pelvis. Now, the pelvis is 3 different bones on each side, all fused together. We have the iliac crest, so that would be like if you put your hands on your hips. In the front, we've got the pubic bones, and in the back, these are called the ischia, or some people call them the sit bones. Now this triangle bone in the middle, I want to spend some time on that because it's actually critically important. It's called your sacrum. I even read once that the word sacrum comes from the word sacred, because even 2,000 years ago, they knew it was a terrible idea to put too much pressure on that bone. Now, let me show you proper way to sit here. So if we have Gertrude sit, we really want her to sit on these sit bones. And she may have to arch her back or her pelvis a little bit to do that. Now, if you're tall, long-legged, you can sit way back in the chair and use the chair support, which is great. If you're short like me, you may have to sit in the middle or the front of the chair with some kind of support behind you. But you notice as soon as she's in this position where she's on her sit bones and not on her sacrum, we get this normal alignment of the curves, which means that these curves can support her weight. And then too, if I had a plumb line to draw down, we could take it from her ear. Well, if she had an ear, the ear would line up over the shoulder and line up over the hip. And it's easiest for her to bear all that weight if it's in line like that. The other thing that's really important about sitting on your sit bones like that very few people know, is it ensures proper pumping motion of the cerebrospinal fluid. So the sacrum and the occiput, these 2 bones work together to have that normal pumping motion of the fluid along the nerves of the spine and the spinal canal there. If you sit on that sacrum, you can actually prevent that normal flow of fluid. Have you ever noticed if you're working on a long project and you're sitting in your chair, and after a while, not only does your back get a little stiff and achy or hurt, sometimes you get like a pressure feeling at the base of your skull, or maybe you even get a headache. Chances are you've been sitting on that sacrum, you're blocking that normal flow of CSF, and that's the result. So it is really supremely important that we learn to sit on those sit bones and not on the sacrum. And this is something I know every single one of us probably do it at least once a day, but some of us probably do it 4, 6, 8, 10, 12 hours a day. So you're never going to be perfect, but at least if you have the information, you can try to work hard from here. I feel like just in this little topic, we've covered a lot, but there's a ton more to cover. I could talk about how to sit when you're in your car or at your desk, or how to hold your legs so you get proper blood flow. We'll talk about those things in the next week. Again, I'm Dr. Meagan Von Holtz. Thank you so much for joining us, and we'll see you again in a couple weeks.